Question 1. In light of recent developments, Dr. Samantha Lee, a health physicist overseeing a radiology department, is tasked with evaluating radiation risk to a pregnant staff member who inadvertently worked in a fluoroscopy room for several days during early pregnancy. The worker's badge shows a deep dose equivalent of 0.7 rem, 7 MSV, over a 2-week span. According to SRP Report No. 116, regulatory guidance from 10 CFR 20.1208, what action should Dr. Lee prioritize? A. Recommend immediate reassignment to eliminate any further radiation exposure during pregnancy. B. Report the exposure as an occupational overexposure to the NRC and initiate fetal dose reconstruction. C. Continue regular duties while applying standard ALARA principles without specific fetal monitoring. D. Initiate fetal monitoring and reassess work assignments, ensuring the dose limit of 5 MSV is not exceeded. Answer. Correct answer. D. Explanation. 10 CFR 20.1208 stipulates a declared pregnant worker must not exceed 5 MSV, 0.5 rem, to the embryo fetus. Since 7 MSV exceeds this, fetal monitoring must be initiated while reporting isn't mandated unless limits are grossly exceeded. Reassignment may be unnecessary if future exposures are limited. ALARA remains essential, but fetal requires specific action beyond standard monitoring. Question 2. Through careful analysis of a nuclear facility engineer is tasked with selecting appropriate detectors to measure low-energy neutrons from a reactor pool. Which of the following devices is best suited for this application? A. Proportional counter with BF gas. B. Geiger monotube with thin mica window. C. Plastic scintillator with photomultiplier. D. Ionization chamber filled with argon. Answer. Correct answer. Explanation. BF-filled proportional counters are highly sensitive to thermal and epithermal neutrons due to the 10B Na 7Li 10B Na 7 reaction. GM tubes and ion chambers are poorly suited for neutron detection, especially low-energy neutrons. Plastic scintillators detect fast neutrons, not thermal neutrons effectively. Reference ANSI N.17 IATech Doc 350 on. Question 3. Evidenced by inconsistencies in background radiation levels reported by a portable survey meter at a waste storage site, Dr. Ahmed must assess the instrument's accuracy. What should be his first step in confirming the reliability of the instrument? A. Replace the detector's power source and retry measurements. B. Adjust the background readings to 0 reference manually. C. Verify calibration using traceable check source with known emission. D. Cross-check measurements with similar but newer instrument. Answer. Correct answer. C. Explanation. Calibration verification using a traceable standard ensures the instrument's response remains accurate. Per ANSI NA and NRC Reg. Guide 1.21 survey meters must be calibrated with NIST traceable sources. Replacing batteries or comparing with another meter is not reliable calibration method. Question 4. From the perspective of Mr. Grayson manages a hospital's nuclear medicine program. He plans to dispose of radioactive syringes contaminated with TC-99 meters. The waste activity is now below the license-specified thresholds after decay and storage. What should be the next compliance step under NRC regulations? A. Dispose of the material as regular biomedical waste immediately. B. Confirm radioactive levels are indistinguishable from background and deface labels. C. Dilute the waste in solution and release into the sanitary sewer. D. Transfer waste to licensed low-level radioactive waste disposal facility. Answer. Correct answer. B. Explanation. NRC's NUREG 1556 specifies that decayed waste, short-lived isotopes, can be discarded as non-radioactive waste only after confirming background level activity and removing radioactive labels. Disposal before verification, dilution for sewer release, or unnecessary transfer violates protocol. Question 5. Examining the consequences of the spectrometry, lab analyst identifies an unexpected gamma peak at 662 keV. What is the most probable isotope and what quality control action should be taken? A. Identify CS137 and reevaluate system background levels. B. Identify COSXD and recalibrate with a dual energy source. C. Confirm M241 contamination and increased detector shielding. D. Attribute to I-131 and rerun efficiency calibration. Answer. Correct answer A. Explanation. A 662 keV gamma peak is characteristic of CS-137. Its appearance may indicate contamination or background buildup. Proper QC requires investigation of system cleanliness and recalibration if needed. COS60 emits at 1173 and 1332 keV and M241 peaks at 59.5 keV. Question 6. The primary reason for implementing administrative dose constraints within an occupational radiation protection program is to A. Ensure compliance with federal annual dose limits, B. Provide a safety buffer below regulatory limits to promote dose reduction, C. Align organizational practices with A. Emergency exposure guidelines, D. Avoid the need for personal dosimetry. Answer. Correct answer B. Explanation. ALORA emphasizes minimizing exposure as low as reasonably achievable. Administrative constraints act as internal thresholds below regulatory limits to maintain conservative dose practice. NRC Regulatory Guide 8.10 and ICP 103 advocate for such proactive controls. Question 7. Based on the information Octomire is assessing, a worker exposed to inhaled PUT-239 biokinetic models suggest retention in the alveolar region with translocation to the liver and bones. Which model best supports the estimation of dose? A. Human respiratory tract model ICP 66. B. MERT schema for systemic distribution. C. ICP 30 gastrointestinal absorption model. D. I emergency response biokinetic tool. Answer. Correct answer A. Explanation. ICP publication 66 provides the respiratory tract model tailored for inhaled radionuclides, accounting for deposition, clearance, and translocation. MERD and GE models do not capture inhalation kinetics effectively. Reference ICP 66 DOE Internal Dosimetry Handbook. Question 8. During the process of selecting materials for shielding diagnostic X-rays, an engineer compares lead, plastic, and aluminum. Which material offers the most effective attenuation and why? A. Plastic, due to low bremsstrahlung production. B. Aluminum for moderate attenuation and cost efficiency. C. Lead, due to high atomic number and photoelectric absorption dominance. D. Steel for its density and neutron moderation capability. Answer. Correct answer. C. Explanation. Lead's high Z value enhances photoelectric effect at diagnostic X-ray energies 30150 keV, providing superior attenuation. Plastic is not suitable due to low Z, and steel is better for neutron shielding. NRP report No. 147 confirms lead's optimal shielding efficiency. Question 9. While examining a synchrotron facility, Mr. Bennett evaluates secondary radiation hazards near the beamline. Which component poses the highest risk for induced radioactivity requiring special waste handling? A. Water shielding panels around the magnet core. B. Beam stop made of copper. C. Lead bricks in external shielding. D. Beam diagnostic probes made of graphite. Answer. Correct answer. B. Explanation. Copper has a high probability for activation, producing isotopes like Cu-64 and COS60. Beam stops absorb high-energy particles, making them prime sites for activation. Water and graphite have lower activation potential. Refer to ARP 144 and EATRS 283 for induced activity management. Question 10. To illustrate this point, a health physicist compares the use of thermoluminescent dosimeters (TLDS) with optically stimulated luminescence dosimeters (OSLDS) in a high-radiation lab. Which statement best represents the operational advantage of OSLDS? A. TLDS provide a higher energy resolution than OSLDS. B. OSLDS are reusable and allow multiple readings without erasing the signal. C. OSLDS require cryogenic storage for accurate readings. D. TLDS provide dose data in real time, unlike OSLDS. Answer. Correct answer. B. Explanation. OSLDS can be reread multiple times without signal loss, offering verification capability. TLDS lets their stored information after readout. Both are passive and neither provides real-time data reference, i.e. radiation protection dosimetry guidelines. Question 11. Based on the information regarding the design of radiation shielding for a new medical facility, it has been proposed that the walls must be made of concrete. The calculated thickness of the wall to achieve the desired shielding effectiveness for X-rays is 10 centimeters. The building has several rooms used for diagnostic radiology, and the required shielding will depend on the expected radiation exposure levels and occupancy of adjacent areas. Which following factors must be considered when designing effective radiation shielding for these spaces? A. Only the energy of the radiation and the type of radiation should be considered. B. The construction material and its ability to attenuate radiation are the only relevant factors. C. The occupancy factor of adjacent areas and the distance to sensitive areas should be evaluated. D. Only the maximum radiation dose rate allowed by law should determine shielding thickness. Answer. Correct answer. C. The occupancy factor of adjacent areas and the distance to sensitive areas should be evaluated. Explanation. Effective radiation shielding design must consider multiple factors, including the energy and type of radiation, construction material, and attenuation properties. The most important factors to consider, however, include the occupancy factor of adjacent areas and the distance to areas with sensitive populations, e.g., offices, patient waiting rooms. The principle of ALARA, as low as reasonably achievable, must also be implemented to minimize exposure. Shielding should meet local regulatory requirements, such as NRC guidelines for dose limits, taking into account the occupancy factor and how much time individuals are exposed to radiation. Concrete's attenuation properties are important, but they must be weighed alongside these other critical factors. Question 12. In the context of nuclear reactions and interactions, suppose a neutron interacts with a target material resulting in a nuclear reaction. The target material has a high neutron absorption cross-section. Which of the following reactions is most likely to occur when the neutron interacts with this material? A. The neutron will undergo elastic scattering, transferring energy to the target. B. The neutron will be absorbed and the target material will undergo nuclear fission. C. The neutron will be absorbed and the target will undergo neutron capture, resulting in a gamma ray emission. D. The neutron will be reflected by the target material without any energy transfer. Answer. Correct answer. C. The neutron will be absorbed and the target will undergo neutron capture, resulting in a gamma ray emission. Explanation. When neutrons interact with materials, the most common interactions are elastic scattering, where the neutron transfers energy to the target, and neutron capture, where the target absorbs the neutron, often leading to the emission of gamma rays. A material with a high neutron absorption cross-section is more likely to capture the neutron, leading to the formation of a new isotope and the emission of gamma rays, rather than undergoing fission. The absorption cross-section is a key factor in determining how likely a material is to absorb neutrons. In nuclear reactors, neutron capture is often used to detect or utilize specific isotopes. Question 13. Which of the following statements is true about the biological effects of ionizing radiation at the molecular level? A. Ionizing radiation always leads to cell death in exposed tissues. B. Ionizing radiation can cause damage to DNA, potentially leading to mutations or carcinogenesis. C. Ionizing radiation affects only the outermost layer of cells with no deeper impact. D. The effects of ionizing radiation are solely determined by the intensity of exposure, not by the type of radiation. Answer. Correct answer. B. Ionizing radiation can cause damage to DNA, potentially leading to mutations or carcinogenesis. Explanation. Ionizing radiation has sufficient energy to remove tightly bound electrons from atoms, which can lead to DNA damage. This damage can result in mutations, which may cause cancer, carcinogenesis, or other genetic disorders. The extent of damage depends on the type of radiation, e.g., alpha, beta, gamma, and its energy, as well as the dose received. While some radiation can lead to cell death, other times it may cause DNA damage that does not result in immediate cell death but can still lead to long-term biological effects. The ALARA principle emphasizes minimizing such risks in radiation safety. Question 14. When considering the appropriate calibration procedure for personnel dosimetry systems, which of the following is most important in ensuring accurate measurements? A. Calibrating the dosimeter only for beta radiation because it is the most commonly encountered radiation type. B. Using a standard calibration source that simulates the range of radiation energies likely to be encountered in the workplace. C. Calibrating the dosimeter for gamma radiation at a single energy, as gamma rays are the most penetrating. D. Calibrating the dosimeter only when it is first used and not after that. Answer. Correct answer. B. Using a standard calibration source that simulates the range of radiation energies likely to be encountered in the workplace. Explanation. The calibration of personnel dosimetry systems, such as ELDS, oscills, or film badges, must be performed using a standard calibration source that accurately represents the radiation energies typically encountered in the workplace. Calibration should cover a broad spectrum of radiation types, energies to ensure accurate readings across a variety of exposure scenarios. Calibration for only one type of radiation, e.g. gamma, is insufficient because it does not account for variations in radiation exposure, e.g. alpha, beta, or neutron radiation that may also occur in the workplace. Question 15. Given the circumstances of a radiological emergency, a radiation safety officer, RO, is tasked with evaluating the level of radioactive contamination in an area following a spill of radioactive material. What is the most appropriate action to take first? A. Immediately evacuate all personnel from the contaminated area. B. Begin decontamination of affected personnel and equipment without delay. C. Measure the radiation levels using appropriate survey instruments before making any further decisions. D. Wait for additional personnel to arrive before taking any action. Answer. Correct answer. C. Measure the radiation levels using appropriate survey instruments before making any further decisions. Explanation. In a radiological emergency, the first step is to assess the level of contamination and radiation levels in the affected area using appropriate survey instruments, e.g. GM counters or scintillation detectors. This ensures that the severity of the situation is understood before further actions such as evacuation, decontamination are taken. The ALARA principle should be followed to minimize radiation exposure during the assessment. Evacuations or decontamination should only occur once the extent of the contamination is determined in order to make informed decisions and avoid unnecessary exposure to personnel. Question 16. According to recent studies, the effectiveness of radiation shielding depends significantly on several factors. Which of the following plays the most critical role in the attenuation of gamma rays in a shielding material? A. The density and atomic number of the material. B. The temperature and humidity of the surrounding environment. C. The thickness of the shielding material alone, without considering its composition. D. The external pressure exerted on the shielding material. Answer. Correct answer. A. The density and atomic number of the material. Explanation. Gamma ray attenuation is primarily influenced by the density and atomic number of the shielding material. Higher atomic numbers, and denser materials are more effective at attenuating gamma radiation because they have more electrons to interact with the gamma photons. The photoelectric effect and Compton scattering are key mechanisms that contribute to attenuation. Like lead and concrete are commonly used because of their high density and atomic number, which enhance their shielding effectiveness. Question 17. Taking into account the process of radioactive decay, which of the following equations most accurately describes the decay process for a sample of a radioactive isotope An equals E0e, LTN T N0e, LT, where L is the decay constant, Bn equals N01, LT T N01 LT, representing linear decrease in activity, C N equals N0e, LTN T N0e, LT, where L is the decay constant, D N equals N0x, LT N T N0x, LT, showing exponential growth. Answer. Correct answer. C. N equals E0e, LTN T N0e, LT, where L is the decay constant. Explanation. The correct expression for the radioactive decay of substance is given by N equals E0e, LTN T N0e. LT, where N0 is the initial number of nuclei, LL is the decay constant, and TT is the time elapsed This equation describes exponential decay as the number of radioactive nuclei decreases over time in manner proportional to the current number of undecayed nuclei. The other options incorrectly describe either linear or exponential growth, which does not represent radioactive decay. Question 18. Which of the following is the best method to minimize radiation exposure during an industrial radiography operation? A. Maintain as much distance as possible from the radiography source and minimize exposure time. B. Use a higher dose rate to shorten the total exposure time even if it increases radiation levels. C. Perform the radiography procedure without protective barriers if the exposure time is minimal. D. Ensure that only trained personnel enter the area while others can remain exposed. Answer. Correct answer A. Maintain as much distance as possible from the radiography source and minimize exposure time. Explanation. The primary strategies to minimize radiation exposure are based on the principles of time, distance, and shielding. Maintaining distance from the source and minimizing exposure time are fundamental methods to reduce radiation dose in industrial radiography. Shielding, such as using barriers to protect workers, is also a key factor in reducing exposure. The principle of ALARA applies here, as it encourages reducing exposure to the lowest feasible level by managing time and distance. Option B would increase exposure, and C and D ignore safety protocols. Question 19. Under the assumption that a radiation safety officer is evaluating a scenario where radiation contamination is found in a patient waiting area, what is the primary factor in determining whether evacuation is necessary? A. The radiation dose rate and the duration of exposure to personnel. B. The cost of evacuation procedures compared to the potential radiation hazard. C. The number of people in the area regardless of the radiation levels. D. Whether or not the contamination is visible to the naked eye. Answer. Correct answer A. The radiation dose rate and the duration of exposure to personnel. Explanation. When radiation contamination is found in a public area, the radiation dose rate and duration of exposure are the primary factors in deciding whether evacuation is necessary. The ALARA principle mandates minimizing exposure, so evacuation or relocation should be based on the amount of radiation present and the potential exposure to individuals. Cost or visibility of contamination is secondary to ensuring that radiation levels do not exceed safety thresholds. Question 20. Considering the effects of ionizing radiation on the embryo and fetus, what is the general recommendation regarding exposure during pregnancy? A. Pregnant workers should be exposed to the same radiation dose limits as non-pregnant workers. B. Pregnancy should not affect the dose limits as radiation exposure has no impact on fetal development. C. Pregnant workers should not be exposed to any ionizing radiation unless absolutely necessary and dose limits should be adjusted. D. Pregnant workers can work with ionizing radiation without any additional precautions. Answer. Correct answer. C. Pregnant workers should not be exposed to any ionizing radiation unless absolutely necessary, and dose limits should be adjusted. Explanation. According to radiation protection guidelines, pregnant workers should be protected from unnecessary radiation exposure as ionizing radiation can adversely affect fetal development. The NRC Nuclear Regulatory Commission recommends dose limits be adjusted for pregnant women, typically reducing the dose limit to 0.5 rem, 5 MSV for the entire gestational period, with no more than 0.5 rem, 0.5 MSV during any 1 month. The primary concern is ensuring that fetal exposure remains within safe limits in line with the ALARA principle. Question 21. The hospital is planning to upgrade its radiation therapy equipment. One of the options being considered is a linear accelerator, LINAC, with an energy range that allows for both external beam radiation therapy (EBRT) and stereotactic radiosurgery (SRS). Which of the following is the primary consideration when choosing a LINAC for these applications? A. The ability to provide a wide range of photon energies suitable for EBRT. B. The LINAC's ability to operate with only electron beams for superficial tumors. C. The LINAC's efficiency in delivering high doses in short amount of time, specifically for SRS. D. The LINAC's capability to perform brachytherapy in addition to outin SRS. Answer. Correct answer. C. The LINAC's efficiency in delivering high doses in short amount of time, specifically for SRS. Explanation. Stereotactic radiosurgery (SRS) requires high level of precision and the ability to deliver high doses of radiation in short time to small target area, which is typically achieved through specialized beam modulation and conformity techniques. Linear accelerator (LINAC) used for SRS needs to be capable of delivering high-intensity radiation with minimal exposure to surrounding tissue. While EBUT can be used for broader areas, SRS is more focused treatment, necessitating specialized equipment with advanced capabilities. Question 22. A radiation therapy department receives a new patient who will undergo external beam radiation therapy for a malignant tumor. The tumor is located near critical structures, and the prescribed dose is 60 Gy in 30 fractions. To minimize damage to adjacent normal tissue, which of the following techniques is most effective in enhancing dose precision? A. Using a wide radiation field to ensure all tumor regions are covered. B. Applying intensely modulated radiation therapy to deliver precise doses to the tumor while sparing surrounding tissues. C. Increasing the dose per fraction to shorten the treatment course. D. Using a single large radiation field to minimize patient movement during treatment. Answer. Correct answer. B. Applying intensity modulated radiation therapy to deliver precise doses to the tumor while sparing surrounding tissues. Explanation. Intensity modulated radiation therapy allows for precise targeting of the tumor while minimizing radiation exposure to surrounding healthy tissue. This is especially important when the tumor is near critical structures, as in this case. IMIT uses multiple small beams with varying intensity, allowing for more conformal dose distribution around the tumor, reducing the risk of damage to adjacent healthy tissues. Question 23. A patient undergoing radiation therapy is concerned about potential side effects. Which of the following is the most common early effect of radiation exposure to healthy tissue during treatment? A. Hair loss and skin irritation at the treatment site. B. Severe gastrointestinal bleeding and systemic infection. C. Cognitive deficits due to brain exposure. D. Long-term cardiovascular damage. Answer. Correct answer. A. Hair loss and skin irritation at the treatment site. Explanation. The most common early effects of radiation therapy are acute radiation reactions that affect the skin and hair follicles at the treatment site. These include hair loss, alopecia, and skin irritation such as erythema, dryness, or peeling. These effects are typically temporary and resolve after treatment is completed. More severe side effects, such as gastrointestinal issues, cognitive deficits, are less common and depend on the specific radiation field and dose. Question 24. A medical physicist is reviewing a radiation oncology treatment plan that includes the use of brachytherapy for prostate cancer. Which of the following is the primary benefit of using brachytherapy compared to external beam radiation therapy? A. Brachytherapy allows for larger treatment volumes to be irradiated. B. Brachytherapy delivers radiation from within the body, resulting in higher doses to the tumor with less radiation to surrounding tissue. C. Brachytherapy requires no planning and is faster than ever. D. Brachytherapy is less effective for tumors located deeper within the body. Answer. Correct answer. B. Brachytherapy delivers radiation from within the body, resulting in higher doses to the tumor with less radiation to surrounding tissue. Explanation. Brachytherapy involves the placement of radioactive sources directly inside or near the tumor, delivering a high dose of radiation to the target tissue while minimizing exposure to surrounding healthy tissue. This makes it particularly effective for treating localized tumors such as prostate cancer, and offers advantages over external beam radiation therapy which can expose a larger area to radiation. Question 25. A radiotherapy treatment team is evaluating the use of proton therapy for a pediatric patient with a brain tumor. Which of the following is a significant advantage of proton therapy in this scenario? A. Proton therapy has a higher dose delivery to the tumor and a low dose to surrounding healthy tissues, which is crucial for pediatric patients. B. Proton therapy is less costly than conventional photon therapy, making it the preferred option for pediatric patients. C. Proton therapy is faster than traditional radiation therapy, reducing the time the patient spends in treatment. D. Proton therapy is primarily used for superficial tumors, is not effective for deep-seated brain tumors. Answer. Correct answer. A. Proton therapy has a higher dose delivery to the tumor and a lower dose to surrounding healthy tissues, which is crucial for pediatric patients. Explanation. Proton therapy offers a distinct advantage due to its Bragg peak property, which allows for highly precise dose deposition within the tumor with minimal radiation delivered to surrounding healthy tissues. This is particularly important in pediatric patients where sparing healthy tissues, such as the developing brain, is critical to avoid long-term side effects like cognitive deficits or developmental delays. While proton therapy is more expensive than conventional photon therapy, its precision in delivering radiation makes it beneficial for pediatric and other sensitive patients. Question 26. A radiation therapy team is tasked with evaluating a patient's response to treatment after completing full course of radiation therapy. The patient's tumor has not completely responded to the prescribed dose. What is the next most appropriate step in managing this patient's treatment? A. Increase the radiation dose by 20% to further treat the tumor. B. Change the treatment approach to include chemotherapy or another modality. C. Repeat the same radiation treatment, assuming the tumor will eventually respond. D. Provide palliative care only, as further radiation therapy would not help. Answer. Correct answer. B. Change the treatment approach to include chemotherapy or another modality. Explanation. If a tumor does not respond to the prescribed radiation dose, the next step is to consider additional treatment modalities such as chemotherapy, surgery, or immunotherapy. A multimodality approach can often provide better control of the disease. Increasing the radiation dose without re-evaluating the treatment approach could expose the patient to unnecessary risks, while providing palliative care alone may not be appropriate without exploring other treatment options. Question 27. A radiation oncology team is considering the use of image-guided radiation therapy (IGIT) to improve tumor targeting. Which of the following is the primary advantage of using IGIT in radiation therapy? A. IGIT allows for real-time imaging of the tumor to correct for patient movement and changes in tumor size or position. B. IGIT increases the radiation dose delivered to the tumor without affecting surrounding tissue. C. IGIT is a less expensive alternative to traditional external beam radiation therapy. D. IGIT is suitable only for superficial tumors and does not benefit deep-seated tumors. Answer. Correct answer. A. IGIT allows for real-time imaging of the tumor to correct for patient movement and changes in tumor size or position. Explanation. Image-guided radiation therapy (IGIT) uses real-time imaging techniques, such as CT scans or X-rays, to track the tumor's position during treatment. This allows the treatment team to adjust for any patient movement, tumor shrinkage, or position changes, ensuring accurate delivery of radiation. IGIT improves the precision of radiation therapy, reducing the risk of damage to surrounding healthy tissue and enhancing treatment outcomes. Question 20. A radiation oncology team is treating a patient with a tumor located near critical organs. Which of the following strategies is most effective in minimizing radiation exposure to these organs while treating the tumor? A. Administer the full radiation dose in fewer fractions to minimize the number of treatments. B. Use multiple beam angles to spread the dose over a larger area, reducing exposure to critical organs. C. Utilize image-guided radiation therapy (IGIT) to precisely target the tumor and spare surrounding organs. D. Focus the radiation beams solely on the tumor without considering the surrounding critical structures. Answer. Correct answer. C. Utilize image-guided radiation therapy (IGIT) to precisely target the tumor and spare surrounding organs. Explanation. Image-guided radiation therapy (IGIT) allows for real-time tracking and adjustment of the tumor's position during treatment, which is particularly important when the tumor is located near critical organs. By using IGIT, the radiation oncologist can deliver precise doses to the tumor while minimizing surrounding healthy tissue and critical organs, thereby improving treatment efficacy and reducing side effects. Question 29. A radiation safety officer (RSO) is reviewing protocols for occupational radiation exposure. Which of the following best describes the ALARA principle as it applies to occupational exposure to radiation? A. All radiation exposure must be eliminated to ensure worker safety. B. Radiation exposure should be kept as high as possible while still achieving the desired treatment outcome. C. Occupational exposure to radiation should be minimized to the lowest level that is reasonably achievable, considering technological, economic, and societal factors. D. Radiation exposure is acceptable as long as the dose does not exceed regulatory limits. Answer. Correct answer. C. Occupational exposure to radiation should be minimized to the lowest level that is reasonably achievable, considering technological, economic, and societal factors. Explanation. ELARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure to workers and patients by using the best available technology and practices. This involves not just adhering to regulatory dose limits, but every effort to reduce exposure further through careful planning, proper shielding, and operational controls. The goal is to reduce risks and ensure safety while considering practical and economic factors. Question 30. A radiation therapy department has a policy that restricts the use of radiologic imaging in certain situations. What is the most important factor in determining whether radiologic imaging should be used in a specific patient case? A. The age of the patient and the type of cancer being treated. B. The potential diagnostic benefit of the imaging versus the associated radiation exposure. C. The availability of advanced imaging equipment in the department. D. The patient's request for imaging as part of their treatment plan. Answer. Correct answer. B. The potential diagnostic benefit of the imaging versus the associated radiation exposure. Explanation. The decision to use radiologic imaging must balance the diagnostic benefit with the potential risks of additional radiation exposure. The ELARA principle applies here as well, ensuring that imaging is performed only when the benefit justifies the exposure, especially in cases where the information from the imaging is necessary to treatment decisions. Minimizing unnecessary radiation exposure is critical, particularly in sensitive populations such as pediatric or pregnant patients.